Hormone replacement therapy. Is it a case the more estrogen, the better? We're often told estrogen's a great hormone, and the more estrogen we have, perhaps the better, because estrogen's great for your mood, for your heart, for your brain function, for your bone health. And while all this is true, in my experience of about 10 years now of prescribing hormones, less is sometimes more in terms of estrogen. So I've seen a trend of patients recently who've seen other doctors and then come to see me, not feeling good on their HRT. Some of these women come in on 6 or 8 or 10 pumps of estrogen a day. Now, I will tell you that no patient that I see who I've started treatment on and I've been monitoring for many years takes that much estrogen. So you simply don't need that much estrogen. Quite often, if you're still having symptoms, it can be a case of the balance between the estrogen and the progesterone not being right. And conventionally, progesterone just isn't considered that important other than protecting the womb. But it's so important for mood, sleep, bloating, fluid retention, and hair and skin if we're being a little bit vain. So the balance between these two hormones is absolutely paramount. And actually, you might be better off with a little bit more progesterone rather than just pushing the estrogen up and up and up. And when I do blood levels on these women, their estrogen is like 900. If you're a menopausal woman in your 50s, you do not need as much estrogen as an ovulating woman who's trying to get pregnant in her 30s. You need, of course, enough estrogen for the bone protection, brain protection, heart protection, but not a stupid amount. So, in my opinion, if you're having a lot of symptoms and your doctor keeps pushing up your estrogen, perhaps ask if it might be wise to increase your progesterone also and see how you feel. And perhaps ask for a blood level if you're really on a very high dose, but you're not having a relief of your symptoms. That's my experience from treating thousands of women, where the majority of my women, most women I see don't take more than 2 pumps of estrogen a day. They've got great levels of estrogen and all their symptoms are managed and controlled. I hope you find that helpful. If you've got any more questions about how to use estrogen and HRT, let me know.